in the next 2 days. And I know that my next guest and speaker is going to help us to do that. It's my pleasure to introduce to you Dr. Renee Matthews. Renee is really just such an eloquent speaker about her experience of living with life-threatening food allergies and also with asthma. And it is what I think helped to fuel her decision to become a primary care provider, but also to become a social influencer and to help throughout her community to spread the awareness and preparedness messages that we'll hear from her today. So Dr. Renee, come and share with us a little bit about your why.
Hello, everyone. So yes, I'm Dr. Renee, and I am 46 years old, but I have had food allergies my entire life. I tell everyone I was born this way. So my mother breastfed me because she's an amazing woman, and she learned, I was her first child. So she said, "Oh, I'm going to breastfeed." She was off for 3 months. She breastfed for 3 months. And at the end of the 3 months, she went back to work and she started to feed me food, of course. And oatmeal was the first food, and that was the one that my mother is a respiratory therapist, you should also know. And also I was born with asthma. And so she, of course, respiratory therapist, she knew that as well. So as soon as I was having this oatmeal, she saw and she knew, she said, she's having an allergic reaction. And immediately that's what started our journey. And I was allergic to a whole lot more then than I am now. And everyone's like, "You're allergic to so much," but it was way worse before. So currently I do not eat citrus fruits, wheat, rye, barley, nuts, chocolate, seafood, and I think that's it. And I can't remember sometimes, but in seafood, I also, I cannot smell cooking. Now, I can sit and eat, if someone's eating their seafood, as long as I don't touch their plate, they don't touch mine, I'm fine. But if I walk into a restaurant, a house or whatever, and I smell seafood cooking, I do start wheezing. So like I said, it was far worse before. It is a lot better now. I am so encouraged by all of the amazing things that are happening now because my mom didn't have these options. So how did we navigate the world? We just were careful. My mom, I've often asked, how did I know what I was allergic to? Because I was allergic at such a young age. And she said, I would ask, "Can I eat something?" She'd say, "You're allergic." And finally, it clicked. I figured it out. I was able to catalog all that information. And I was able to, I did a lot of things without my parents. My parents worked full time, so they weren't always with me. Not all of my caregivers could remember all my allergies, but I knew what they were. I also had the blessing of my best friend, which was my sister, who is 3 years younger than me, but my sister was an amazing advocate before we knew what the word advocate was. My sister was my taste tester. She would taste the foods. Even at 6, 7 years old, she couldn't articulate what it was, but she'd say, "Renee, you can't eat this." And 9 times out of 10, she was absolutely correct, and she saved my life many a times. So it is so important that your kids know what they're allergic to. And then it's really awesome if they have a sibling or a friend. So it's really good that they tell their friends that they're allergies. I wrote a children's book because I wanted people to understand how I was able to navigate it, but I also want you to understand, your kids, you'd be amazed the information that they can hold and how they can get through life. I've actually lived in, I think, 3 other countries outside of the US. And obviously I had to eat while I was there. So, and I actually lived on an island for 2 years, which everyone's like, "But you're allergic to seafood." Yes, I lived on an island for 2 years. I went to restaurants and ate. I never had any problems. You don't smell seafood cooking when you go to most restaurants, do you? So I didn't have a problem. And I never had a cross-contamination issue. And I was fine. All of my travels, I usually do not pack my suitcase full of food because I will figure out something that I can eat when I get there. And then, of course, now we have the blessing of the internet. So you can check menus prior to going and figure out, oh, okay, this is what they have, and figure out what you can eat, or figure out you can't eat anything there and you need to make a different choice. I am really good about, letting people know that I have food allergies. I also do carry Avicue. And so I have that with me, and my friends know, and they're like, "Where is it?" In case they know, so that they do have to use it, they can use it. I love that it tells you what to do, because in panic situations, not everybody's as calm as I am. So just in case, they can take care of me. But I have just really been blessed with a really great community that understands that this is me. This is the way it's been. This is the way it is going to be. And I have the cute stories, of course. My mom probably wasn't so cute at the time, but now it's cute. I was trying to help her because that's what I do. My sister had just been born. I want to help mommy. And I decided to crack some eggs because I thought I was going to cook with her, and I'm allergic to eggs. And I especially cannot touch egg whites. So of course, my mom's like, where is Renee? It's so quiet around here. I was sitting in the corner with these eggs all over me, wheezing. And that's why I was so quiet, because of course now I've had an allergic reaction. Of course, my father was at work, and my mother had to put 2 children in the car and get me to the ER because I'm seriously sick. So, and like I said, it's funny now, wasn't funny then. And then curiosity killed the cat the day that I decided, everyone is sitting there eating nuts and cracking these shells. I thought it was really cute. And so I decided, well, while they're doing that, I'm going to try it too. And no one was paying attention, and I decided to do it. And I also decided to stuff the shell up my nose. And my mother, what is going on? Sure enough, she gets me to the ER because of course I'm wheezing at this point. And then when I get there, there's a shell in her nose. My mother was so mad, but and I actually remember that. So curiosity did kill the cat on a few things, but for the most part, I am really good about, knowing. And I also will say that in my household, all of my allergens were always around. My family did not stop eating anything because I couldn't eat them. It's just Renee can't eat them. And so my mom would cook seafood. My father's from the island of Antigua. He was not going to give up seafood because he had a child that was allergic. So she cooked the seafood outside in the garage. And so the house didn't smell like it. And I was fine. I've never had a problem when my mom made seafood. So yeah, I think that the way that I grew up really helped me to where I am now, because I didn't grow up in a bubble. And so I'm able to explore all sorts of different, opportunities and different places and do different things because I know how to handle things and I know what to do, what to say. And so I really want to encourage parents that it's really going to be okay. It's not the end of the world, and your child will have a really wonderful, fulfilling life. I did obviously go off to college and became a doctor, and partly, like you said, due to the fact that I was born with asthma and allergies. So thank you so much.
Thank you, Renee. Before you go, just one quick comment, maybe, because I know you and I have had this conversation about being a person of color.
Yes.
And living with food allergies. Oftentimes, maybe there's some cultural differences or things. Maybe speak to that for just a moment.
Okay. So I will say that it's, their food allergies are common in the Black community, but oftentimes we are not properly diagnosed. So we don't know. So you got sick, but no one ever went and investigated why you got sick. And they just said, okay, well, that person needs to avoid that, but they don't really understand why. And so that can be a bit troubling. And when you don't have the access to go to an allergist to figure out exactly what's the problem and why did that happen. And then also, unfortunately, we have grandparents and great grandparents that don't quite understand. And so they insist on still cooking, I'm allergic to airborne seafood. You're still cooking seafood and you knew I was on my way over, and or I'm staying at your house and I return and I'm like, wait a minute, what's that smell? So, we still have to work really hard to help our, especially the elderly generation, because I think they just don't understand. When they were growing up, it wasn't like that. You just need to be patient and help them understand that this is a serious matter. People can die. And so you need to understand that this is why you have to not cook that, or this is why you cannot feed the child this just because the mom isn't there and you want to feed it to him. No, she told you not to for a reason. And that's why you cannot feed it to him. So it's really important. And unfortunately, like she said, there are some barriers and we don't have the access to the information. So I think that if we got access to the information, I know grandma is not trying to kill her grandchild. I know that for a fact, as well as aunties and uncles. I know they're not, but they just don't understand. And so if you can make them to understand, like I said, my dad is from Antigua and my family, In the islands, it just wasn't as popular, or common to have food allergies. But I came along and now they all understand and it's not a big deal. But it's just about communicating and making them understand. And hopefully we can increase health equality, and we can get access to allergists and immunologists and pulmonologists so that we can have the conversation and people can understand and we can have less children, unfortunately, dying from anaphylaxis.
Thank you, Renee. I really appreciate your perspective and your why. It's been so powerful to work alongside you and looking forward to the next couple of days.
Yes,
thank you. So as we move into our next session, I'm going to invite Dr. Doug Jones to join me here at the podium. He's going to talk about the food allergy pandemic and really bring that to light. And what I have asked is every speaker to sort of start with their why they came to this space, why they're committing to the next 2 days and to this event, and their commitment to the community. And so we'll start with Dr. Jones.
Thank you. It's great to be with you and welcome everyone from across the world and wherever you're watching. So great to be here. My why started shortly after I joined or started my private practice. I'd been just finished my training and I'd been going through and seeing a number of food allergy patients. And there was one family in particular where I'd already seen the son who was allergic to peanuts and tree nuts. And the family brought in their 11-month-old daughter who had a small exposure to milk, and she had some drip on her and she broke out in hives, and the mom was devastated. And it was right before her first birthday, and she said, I don't even know if we can do birthday cake, right? And so she brought her in. She said, gosh, we're already having to avoid peanuts and tree nuts. We hope it's just milk. And long story short, as we tested this patient, it turns out the 11-month-old was milk, eggs, wheat, peanuts, and tree nuts. And the mom was absolutely devastated. And I remember discussing this with her in our clinic. And with tears in her eyes, she said, what do I feed my child? And at that stage, I was sick to my stomach. And I looked back and I said, I have no idea. I don't know. And I was as devastated as her. And as she left, I walked back in my office and I sat there and I thought, I did no service to them today. I gave them no hope. They deserve better. There has to be better. There has to be another way. I can't continue in my role to give this kind of information to somebody that, they just deserve hope. At least that. And so I, at that point, dedicated myself to trying to be better and be more skilled in food allergy in particular, so that I could at least offer patients hope. And so learned, quite a bit about treatment, about options, oral immunotherapy in particular, which we'll hear about over the next couple of days. And as Tanya said at the beginning, we don't want this to be a fear-based conference. We want this, or summit, we want this to be one of hope, because there are choices, there are options. This is 2022. And things are moving rapidly and moving forward, and the science is evolving, and it's amazing. And I'm just really passionate about this, because through the years, my why is I've wanted to make a better impact, a more significant impact, for perhaps those who haven't had a voice, for those who have felt unheard, for those who have been dismissed and not given hope. And my why is to try and give those patients some hope. So let's move into the next phase here. As we have gone through the last few years, the world has been consumed by something that's microscopic, potentially life-threatening, unpredictable. And what has happened? And certain patients or populations are at more risk than others. There's been misinformation, information, division, all kinds of rhetoric going on. And as such, because of the unpredictable nature, because of the potentially life-threatening situation, what did we do? Isolation, uh, distancing, mandates, all kinds of things imposed upon us to try and keep us safe. And it's had a social, mental, emotional, physical, and financial burden on everyone. Does that sound familiar to anyone with food allergy? Does that situation sound anywhat remote familiar to somebody? Yes, that is the life that somebody with food allergy lives every single day. Dr. Renee, that's the life you've lived, correct? Yes. Very similar of that situation. So I think the world has got a small glimpse into what a food allergy patient lives, and so that really is kind of that pandemic. But in terms of also, as we've gone through the pandemic and we've had all of this, what have people searched for? Normalcy. They've wanted a hope for getting back to normalcy. And as I talk to my food allergic patients, that's really what all they want. They want kind of that sense of normalcy. And with food allergy, Dr. Renee also mentioned, with her grandparents, for instance, they don't quite understand because their generation was different than our generation. And one of the questions I get is it truly different? Is there truly a rise or pandemic or epidemic proportion of food allergy? Because as you look at certain things with food allergy, is it overdiagnosed or is it a real true increase? So studies are done, for instance, when you think about food allergy with questionnaires that may be subject to bias. Some may mistake true allergy for just other symptoms with food. Anyone that comes into my clinic so often, if they have any symptom with food, any symptom at all, they think it's food allergy, but that's not necessarily the case. And so are other things just, being mistake for that? There's high false positives with traditional allergy tests. There's also non-validated, widespread use of non-validated tests that give even more false positives and confusion. And about twice as many people think they have food allergy that actually does. So despite all of this, despite these variables, we do know that allergy is increasing in epidemic proportions. And what is happening today is not the same as those that come before us. The statistics are staggering, and I loved how Tanya put it, where in just the few minutes that are talking, people have already gone to the emergency room with anaphylaxis. The prevalence has increased over 50%, and every 3 minutes, someone is having a food allergic reaction. More than 40% of children with food allergy have experienced a serious anaphylaxis. Medical procedures to treat anaphylaxis have increased 377% between 2007 and 2016. So the statistics are real. This is growing in epidemic proportions. But one thing, just like the pandemic with the coronavirus, as we focus so much on positive tests, hospitalizations, deaths, sometimes with food allergy, especially in the medical literature, we often focus on how much time epi is used, how many ER visits, and or even deaths, which are important statistics. But one thing that is often forgotten is I think we need to also look beyond the headline. There is also collateral damage, much like the pandemic, where so much of the media is focused on certain statistics, but so many times the collateral damage is forgotten. It's very similar with food allergy. What about the impact of psychological stress, mental, emotional, social, physical, and financial burden? It's hard to kind of sense the true burden that someone is carrying until that's lifted. And that was probably one of the more gratifying things that I've found in treating food allergy, is seeing that burden lifted from patients. So with this change, is it by chance or has it been true change? So there's a number of reasons that we talk about in terms of why have we had this epidemic rise in food allergy. This is not an all-inclusive list, but I want to just focus really briefly in the time that we have and just hit the highlights